Now we're live.
Yeah. Yes, we are on, and we welcome you, Dr. Eugene Sambataro, and I welcome you. And in the power of the first eternal life creation and the source consciousness field, we welcome everyone who is trying to, reclaim and restore their health the proper way, the right way, the true way. Okay, because there's so many options now, and we're in, although United America is a little slow with these options, but at least we're catching on, and individually we'll try to catch up. So Dr. Jean Sambataro and I, we had that conversation last time, and now this is just a follow-up, and we wanted to focus on the healing modalities in a biological dental practice. So welcome, Jean, and go ahead and introduce yourself and say a little bit about how beautiful, how powerful, how effective your practice is.
Well, thanks for that introduction, and thanks for the invite back. Yes, it's great to be here sharing, my experiences and what we're doing. It's a little bit different, very different than the traditional dental practice for sure, but even a little bit different from most biological practices because we encompass a lot more because we really are addressing the mind, body, and spirit. From the physical body perspective, we're doing some things that are pretty, I'd say, state of the art, and always try to stay about 10 years ahead of whatever else is going on. And just for example, I've been using red light therapy or low level laser therapy, or what they call it now, photo biomodulation. I've been using that for over 30 years. And now it's just suddenly coming to light that this is an important thing for the healing process to use red light therapy. So this is one of the many things we can touch on today. But and this has all come through, an evolutionary process. As you gain more and more knowledge, as you look for more answers, you have to constantly be searching, which really brought us together, right? As Rasha Guardians and the Bioregenesis Academy, looking for answers to our spiritual beings, our higher consciousness, things that aren't taught to the general public. You have to really seek those things out. Actually, I'll take that back. Things, spiritual life is taught to the general public, but it's usually through some misinformation, maybe about a particular religious belief. And we could have a whole nother talk about that, but we'll do that for another time.
Yeah, so you were really ahead of your in your amongst your colleague, and could that be because personally you have your personal quest to really keep searching, and you're just really whatever you uncover and discover, you don't hesitate to share it.
Yes, I like to always take the deeper dive and not accept things on the surface. And you have to really be relentless to get the answers and get the information that you're looking for. And a lot of that has, as you said, has a personal, undertone to it because I'm always looking for things to improve my own health uh, from again, mind, body, spirit, whatever it might be. For example, I learned how to do transcendental meditation back in the early 90s. Um, and I did that for my own purposes and to enlighten myself through higher consciousness. Of course, now as you and I have both moved forward, we know that there's something far greater than that when we talk about uh, quantum healing and using scalar and morphogenetic uh, quantum healing. That's a lot farther and far greater than what I learned from, say, the Maharishi in terms of TM. So I'm always searching for the next best thing. I think we have found something that's extremely, extremely different than what we've probably both have experienced in our entire lifetime.
So true. And yeah, it is our desire, like as if there's always something that's um, making us have that feeling. And now, of
Right.
course, as we know, that feeling is already like a direct cognition from the source that keeps us moving forward. Okay. Now, that the light therapy is the more popular one, and just say a little bit about that light therapy and why there's something much more to recognize beyond that light therapy.
Well, most light therapy, when you talk about photobiomodulation, you're dealing with a specific frequency of light. Generally, it's two different ones: a visible light, which is the red light, and that's in the 600 range, 600 nanometers, 640, 680 nanometers. And then you have the invisible light spectrum, which is in the 800 to 880 nanometers. They're both very healing to the body from a physical standpoint, but nothing is as powerful as something that's working at a higher consciousness and actually having an effect on your DNA, because that's where the true healing is going to occur, as you know. So we introduced, besides a lot of other modalities which we can talk about, the most powerful thing now is the Rasha, which is in our office, and we use that for pre-treatment, post-treatment, and then treatment for other things that may not seem related to dentistry. Like we have a lot of Lyme patients, we have mole patients, but it's very, very practical for healing of the jaw after surgery, say after an extraction or placing an implant, and just general healing, because one thing and only one thing that's necessary is to get someone into that parasympathetic state. And when in that parasympathetic state, that's where healing occurs. So that's pretty well known in the, let's say, healing field. Um, but there's a difference from using base 10 healing versus base 12 healing, as you and I know. So we've cranked it up a whole nother level in terms of the ability to heal the morphogenetic field, the DNA, even including the intron DNA. So now we have some modalities that can take us to a much, much greater level.
Because from what you and I have learned, that the base 10 is like it's somewhat effective, but it will always be temporary. And then in the long run, if people are not careful, they will always have some, let's just say, an adverse effect in terms of that first conception cells, right? That's what I'm understanding. So, to people, sure, don't, you can use it and they get, because we can't deny that some people will say, oh, but it benefited them. And I said, out of respect, sure, sure. And but just like in your own being, you have that search to like keep going to what's really true, that will not be finite. And that's when we go to the base 12 and Russia, that Russia is developed and created, and that. But let's just talk about what is also the difference from when you're thinking of, when you're looking at these things, you're looking at them not as like a dead beings, right? Or you
Right.
look at them as alive. So talk about that, because then I want to invite people to start thinking that everything comes from source and is consciousness, and then they're living.
Yeah, I'm going to take a step back and talk about, and I think the audience might understand, most of medicine, and you know this, being in the medical field for so, let's get some feedback, is that it's all symptom based. So we're trying to, let's say, address the symptoms by suppressing the symptoms. If you're in pain, let's suppress the pain with, say, a pain medicine or anti-inflammatory or non-steroidal anti-inflammatory, or we're trying to reduce inflammation on an acute or chronic level. We're always addressing the symptoms, not getting to the underlying cause and getting to the true meaning of healing. And the true meaning of healing doesn't happen on a physical level. As you said, trying to get closer to source, that's where the healing occurs. And most people have no idea how to do that. We think we're doing it. I thought I was doing that by doing transcendental meditation. I mean, even in the word transcend, to transcend means to, go to a different plane of consciousness. And there is some studies that show there is some healing. And I think the point you made is it short-term healing or long-term healing? And I think unless you're using scalar energy and dealing with the morphogenetic field and the higher consciousness in terms of different dimensions, and you said reaching towards source, the healing is only going to be short-term. But in many cases, that's all people are really looking for. They want the inflammation to go away. They want the pain to go away. They want to sleep better, but it's all short-term. If we're looking at creating longevity, if we're creating a real sense of joy and happiness, we've got to go to a different level. And the Base12 technology, which I've bought into, if you don't know what you don't know, right? So, and it's not bad. So if you're using light therapy, we also have something called the light portal, the biocharger, pulse electromagnetic frequency. These are all great modalities. If you're dealing with Base12 technology, you're just not going to get the type of healing that you can get with Base12 Rasha technology.
Describe more what the Rasha technology is, because people are, as I said, they know about about the light, and you said a green and a red, and I've seen the blue too, a blue color also.
Oh,
And more for the skin.
Oh,
And
right.
right, and also there's also that they offer in terms of like some sound, but the Russia that you have is different, and it's really sort of like a hidden gem.
Yes, it is. We truly know that. Well, when you're talking about healing by putting someone into a parasympathetic state, and I said there's these technologies, whether you're using light or sound, sound can involve brain entrainment, so you're using both hemispheres. So all those things can address those things. It's just how it's done, the frequency that's provided to the body to actually induce changes physically and at the conscious or subconscious level doesn't occur in Base12 technology. Now in the Rasha, they're using Tesla coils, which also the biocharger has Tesla coils, pulse electromagnetic frequency. So there's a lot of, let's say, biohacking technology that involves using Tesla coils. But with the Rasha, which Dr. Eugenio Rivera has invented, he's using not just that, but specific frequencies that he has been given that have, through this Base12 technology, it just takes us to a whole different level of healing. As you had mentioned, even getting down to the, to the source, what source creation, the embryonic state, DNA activation, reversing DNA mutation. I mean, these are things that are required to really establish true healing. So we can get, even if go back to pharmaceuticals, I mean, if you have inflammation, you can take an anti-inflammatory. It'll reduce the inflammation. And to a point, maybe you're out of pain. Is that true healing? So if we take certain Base12 technology, same thing. We can use light therapy. We can use sound therapy. Again, we're going to get some healing, but it's limited to what is possible from something that's Base12 technology.
And I'm glad you mentioned about the DNA distortions and mutations and the activation, because it's also like a growing buzzword, okay? Buzzword for in many chats that I see in many groups.
Right.
And there's just so many good in a way there, I call it the gift of gab. They can just listen to it and just win you over. But then what is that so important for that DNA activation in terms of your practice, in terms of that dental healing? Why should they care about that?
Well, it depends on if they really want to take their level of healing to a higher dimension. It's going to require this base 12. If, for example, they have a toothache. All right, so I can alleviate a toothache. Most of the time, it's going to be a cavity. So we clean out the cavity. We'll put some kind of biocompatible filling in there, and suddenly their pain's gone. Well, what caused that tooth to go bad in the first place? What causes decay? Well, we know nutrition's a factor. We know that lifestyle is important. So we can create these healing modalities through good nutrition, exercise, sleep, stress reduction, and some of these other base 10 technologies. But are we really getting the body into a higher dimension to allow it to truly, and not just, like you said, people gabbing, truly allow the body with its innate wisdom to heal itself? So we have that power when we connect to source, is to heal ourselves. You just have to know how to do that, whether it's through Rasha or other activations and techniques, which, has been certainly taught, as I said, when I learned TM, to transcend and raise your consciousness. And that's the other buzzword that's used quite often.
Mm-hmm.
Let's raise your this is going to raise your consciousness. What does that really mean? It sounds good, because if I'm raising my consciousness, does that mean I'm changing the world? I'm changing the people around me? Am I a better person? What does that really mean? If you're not really, truly having that change of consciousness to a higher dimension. So it can't just be words coming out of your mouth. Oh yeah, I can raise your higher consciousness. And most, healers can't even define what that means. So this is far different. So what does that have to do with dentistry? Well, I'm just a health provider who's trying to create better healing. So I consider myself a healer. I happen to pick dentistry as a profession long before I knew any of this other information. So now all I'm doing is integrating it, so we can now take it for those who choose so, and it's all free will. You have to choose it. It's not someone else's responsibility to heal you. It's your responsibility. So you have to be able to connect with certain higher levels of consciousness to be able to do that truly. And so the question is, how do you truly do that? Now, we know that because we've seen other healing modalities, that there's nothing really to compare with the Rasha technology in terms of doing that, as well as some of the other activations and techniques that you and I have learned, which would take a whole nother conversation. But right.
Yeah, but at least let's see what can you suggest, at least for people can begin in their own little way, even just to start in terms of searching, in terms of upgrading their practice.
In terms of their dental practice.
Well, yeah, in relation to the dental practice and also to the DNA. And you know why I'm very happy and excited that in this new YouTube channel that I have, and you are my very first one here, just because I truly believe that a practice like yours must be the first one even before they go to their medical doctor. I'm sorry, but there's so much things hidden that and can be found out about someone's health by just looking at the teeth. So
Absolutely. Well, the mouth truly is, the window to the rest of the body. I mean, think about it. It's the beginning of the digestive system. So everything starts in the mouth. So digestion, at least carbohydrate digestion, occurs in the mouth through the release of amylase enzymes. So it's all starting there. Our teeth are required to be able to chew and masticate our food enough to stimulate those enzymes. So you need good, healthy teeth. Gum tissue is like skin, but inside the body. So when it's inflamed and it's bleeding, it will allow bacteria, specifically the most disadvantaged bacteria are these anaerobic type bacteria. They live in the absence of oxygen, and they produce certain highly toxic substances, and those can get into the bloodstream and have a systemic approach to other diseases, especially things like cardiovascular disease and diabetes, high blood pressure, and stroke. We know these have an association in arthritis. I would add on to that, between an unhealthy mouth and systemic health. So what happens is dentists are here to kind of, let's say, patch up what's gone wrong. So someone has a bad diet, they get a cavity. The cavity is now causing pain. So we will clean out the decay and put, well, some dentists will still put amalgam in there, which is toxic. So now you've taken a person who's already unhealthy because their teeth are breaking down, and you're putting a toxic substance in there. That's going to just further the process, breakdown, and degradation. So we're sometimes the healer, but also we could also be causing further breakdown by the treatment that we do. So I'm putting mercury amalgam in, to using things like toxic fluoride, doing root canals, which harbor bacteria. So these are all things, taking teeth out for orthodontics, which is not absolutely necessary in most cases. So are we here to create better health, or are we adding to the problem? So that's just on a physical, fundamental level. It doesn't, so you got to be able to really grasp and embrace that first before you can even think about how do we involve the mind and the spirit. Because if you can't get past the physical part, you're just not going to understand the other. So as a dentist, you got to make a commitment to where do you fit in this healing continuum for the patient, from whether it's an infant till they're a senior citizen. We're here to make their lives better, not just to patch up their mouth. So we can, from a physical standpoint, protect them from other diseases like diabetes. We can protect them by not putting in more toxic material into their mouth, and educating them about good diet, stress reduction, and better sleep. That's the first thing. If they can embrace that, then I can have a conversation about what we can do to heighten their consciousness to a point where now the body, in its innate wisdom, can start to heal itself. That's sometimes a pretty difficult concept for people to accept, especially in today's modern medical model. But as you probably do, we tend to attract people who are looking for something far greater. So it's an easy conversation to talk about these other healing modalities. Initially, whether it was the light portal, the biocharger, or the pulse electromagnetic frequency, or light therapy. And now, let me talk to you about the Rasha. And when they hear that, they are super excited. So what can they do? They can participate. That's only part of it. At some point, Grace, I know you and I, as we finish our programs, will be able to go out and teach all the stuff that we're learning about raising our consciousness, moving to a higher dimension, really getting to that self-healing state so that we don't have to be sick and be part of the, let's say, sick health system.
I I cannot agree more. Strongly agree. How can one find a biological dentist who's like you? Or
Yeah.
where can they find you? Or tell us where they can find you.
Well, they can find me at juliandentist.com or juliandental.com or juliancenterforsleep.com. I'm in Columbia, Maryland. There are a fair number of biological dentists. There's more and more. We talked about using the buzzword higher conscious, but there are some dentists using biological dentistry who aren't fully trained in, let's say, all the modalities we're talking about as a biological dentist. And in terms of using other modalities, I really don't know anyone out there that certainly has brought into their practice the use of the Rasha for sure. Or even some of the other modalities I was using before I discovered the Rasha, like I said, the pulse electromagnetic frequency, red light therapy. That's becoming more common. Certainly not the light portal. The light portal is something you lay down in. It has brain entrainment. So it's using sound therapy, vibration therapy, some chakra balancing. But as you know, all those things I just said, that's all great, but it's base 10. Now, if we take chakra balancing, brain entrainment, parasympathetic stimulation on a base 12 technology, it's far greater. So, in answer to your question, and I wish there were more dentists out there that were not just doing biological dentistry. I wish there was more of that, but then also going to the next level, which we've done here.
Well, thank you so much. I just wanted to make this short and sweet. So what do you think? Do you have anything more that you really wanted to emphasize or share? But I said short and sweet.
Well, I thank you, one, for giving me this opportunity, your first YouTube. I think what's important, and you and I have discovered that you never stop looking for answers. The answers are out there. Do not accept anything as the truth without some evidence through direct cognition, higher sensory perception, um, something that you need to be able to embrace. Listen, as Jerry would say, listen to the energy from the people that are speaking to you. And if it doesn't fit you, don't believe that that's the end, that there's nothing else out there. So you and I have been on this journey for a long time, and we will continue on this journey. And we will discover new things all the time. But you have to be very open-minded. Um, and we have the ability, as we reclaim our memories and reverse our mutated DNA through specific things like the Rasha and other modalities and techniques and activations that we've learned. What is the limit? So there is unlimited potential in terms of the healing ability of the body. Don't buy into the average length of a woman's life is 81 and a man is 78, whatever those numbers are these days. Because if you believe that, that will become true. I don't believe we need to age. And I'm looking for all the answers to stop that and maybe reverse that or halt it. And that's the I wanted to say, because we've talked about a few buzzwords, be careful about the anti-aging movements. Many times they're just trying to sell you a product or some other technology without real true evidence of its ability to heal and slow down the process of aging. So
Thank you. This is wonderful. Just short and sweet to the point, and just to give you a little taste of what we will be doing more in the future. And we do want to embrace anyone who is also ready to take on this journey. The
yeah.
more, the merrier.
I'm so thrilled to be on this journey with you, Grace. So thank you for all you're doing.
And so, for those of you who this episode resonates, please share it, okay? And we're open to suggestions of other topics or other conversations. And this doesn't have to be the last one. As I said, it's just the beginning, and we'll just continue. And you're with us as we are with you, wherever you are. So
Awesome.
take care. And in eternal reverence, joy, and gratitude to the unceasing love and mercy of the one source most divine, we thank you and we love you and take care of yourselves.